Hello, my name is Abdulaala ALIBRAHIM at University of Bridgeport. My senior project is HIV/AIDS prevention. I'm going to talk about important facts. A person with HIV can only spread the diseases through a specific body fluid, and they are as follow as semen, breast milk, blood, as well as pre-seminal, rectal and vaginal fluids, and also the primary reason for spread of HIV in the United States is through sexual intercourse and the wrong sharing of injecting and needles with someone diagnosed with HIV. Correct usage of condom while any kind of sexual interaction, and usage of a fresh sterile drug injecting equipment can heavily decrease risk of HIV infection. People with high risk of HIV can reside to pre-exposure prophylaxis, which involves taking dosage of HIV medicine at regular basis. Mediums through which HIV spread, only certain body fluids act as HIV transfer. It is important to recognize these medium in order to understand how to prevent HIV and diagnosis. Blood is the most common carrier for HIV virus. The precautionary measure should be taken to make sure a blood is HIV free prior to transferring. Semen is one of the main ways through which HIV spread. Simple prevention can be the correct usage of condom while condition and kind of sexual activities with partners. Breast milk can spread HIV to infants. Therefore, HIV with mother should be refrained from feeding their breast milk to their newborns. Other major mediums include vaginal fluids, pre-seminal fluids, and rectal fluids. I'm going to talk also about fact HIV transmission. HIV transmission occurs when body fluids interacts with amnios membrane or damaged tissue. Adding to that, can be also spread by directly injecting into the bloodstream, typically from a needle or surgeon. The mucous membrane are found inside the rectum, the vagina, and the open of venous and the mouth. The primary reason for HIV transmission in the United States is sex or sharing injecting drug equipment with person diagnosed with HIV. HIV infected mother can infect their child during a pregnancy, childbirth, or breastfeeding, as we discussed earlier. HIV infection can occur after receiving a blood transfusion or organ and tissue transplants from an HIV-infected donor. In modern times, the risk of getting HIV through the earlier means mentioned is very narrow, as everything is checked for HIV virus prior to transfer or transplant. It is not possible to get HIV from intended contact with any infected person. HIV doesn't spread from contact with objective used by person infected with HIV either. Ways to reduce risk of getting HIV. It is important to know your partner HIV status for safe sex. Adding to that, it is also vital to get tested and know your own status. These precautions limit the risk of separate. To reduce risk of HIV, one must indulge themselves in less dangerous sex. Out of all the methods, anal sex is the most risky when it comes to spreading HIV, and hence should be done with extra preventive measure or avoid it, and also use condom. Limit your number of sexual partner. There more partner means there are likelihood of getting HIV through the mediums discussed earlier, or even get sexually transmitted diseases, STD. It is safe to get tested often for HIVs, STD, in case one has regular or multiple sexual partner. As we mentioned this, a pre-exposure prophylaxis can be used to limit risk to HIV in people who are at high risk. Discussing such a matter with health care provider can provide proper safeguard in case of injecting any kind of a drug into one's body. It is essential to use sterile drug injecting equipment without sharing. Ways to protect sex partner of HIV. Regular medication can be used to undermine the effect of HIV virus in any infected person's body. It helps them live longer and healthier, in contrast to without any medical aid to reduce the amount of HIV in the body. As a result, decrease the risk of HIV spreading to partner. PrEP is also a great option for people whose partner have HIV. It is vital to use condom during sexual intercourse, even if the partner are under HIV medication and PrEP. Needles, surgeon, and or other injection drug equipment can't be shared with partner at any cost. Thank you.